Welcome to the Making Kids Count podcast, brought to you by Kentucky Youth Advocates, where we sit down with policymakers, community leaders, and youth to discuss ideas to make Kentucky the best place to be young.
This is Shannon Moody, Chief Policy and Strategy Officer at Kentucky Youth Advocates, stepping in for Terry Brooks today. Thanks for tuning in to the Making Kids Count podcast. Today, I'm joined by some key partners and experts in the realm of adverse childhood experience and building resilience. So Dr. Wendy Ellis is the founding director of the Center for Community Resilience at the Milken Institute School of Public Health at George Washington University. Her innovations provide a platform for community-based efforts to address adverse childhood experiences and adverse community environments, or as she has coined it, the pair of ACEs. Dr. Ellis served as keynote at Bloom Kentucky Summit in Shelbyville in May, and we are so glad that she is able to join us today and was able to join us back in May and show us some of her dance moves. We're also joined by Dr. Courtnee Melton-Fant, assistant professor at the University of Memphis and author of the Sycamores Institute's Economic Impact of ACEs in Tennessee. Dr. Melton-Fant played a key role in supporting Bloom Kentucky with our recent Economic Impact Report. We are also joined today by Barry Allen, President and CEO of the Gheens Foundation, who is the lead grant maker for the innovative Bloom Kentucky initiative and a great collaborator and convener for our folks across the Commonwealth when it comes to adverse childhood experiences. And then finally, Hannah Edelen, my colleague, is here as the lead on Bloom Kentucky from Kentucky Youth Advocates, and we're really grateful to dive into this conversation today. So we will be diving in to the latest report from Kentucky Youth Advocates in Bloom, Kentucky, titled The Economic Impact of ACEs in Kentucky, and discuss some of the implications and opportunities as we look towards the 2026 budget session here in Kentucky. So I would like to start with Barry Allen. And Barry, before we jump into the report, can you tell our listeners a little bit more about Bloom, Kentucky for those who may not be familiar?
Yes, Shannon, thank you. And thanks to each of you who are listening for setting aside this time to participate in this, what we consider to be an important session concerning this important report that we trust will facilitate positive legislative action concerning this important issue. And briefly, Bloom Kentucky is a first ever public policy advocacy initiative being conducted by a coalition of grant-making organizations from across the Commonwealth. The purpose of our initiative is to eliminate the impact of ACEs and to give our children and families reason for hope for their futures. As grant makers, we came to the realization and the conviction that to make systemic change, and not just to provide temporary relief to the multitude of needs among our fellow Kentuckians, required us to engage in policy advocacy. And the severity of the scourge of child adversity in the Commonwealth became our cause. So the coalition is indebted to the leadership of KYA for facilitating its effort in this important initiative. Shannon?
Well, Barry, we are so grateful to you and the Gheens Foundation for really leading the charge and getting folks around the table who this may be the very first time that they've been involved in policy and advocacy. So we're really grateful to that.
Good.
And
Thanks.
in mention of that economic impact report and what we know around adverse childhood experiences and in Kentucky, especially in the prevalence, Hannah, talk a little bit about what this report is and why we put together and why you think it's a needed resource for community partners and policymakers.
Absolutely. Let's dig right in. The report really examines the economic impact of ACEs in Kentucky. One of the main key takeaways from the report is that the total annual economic burden of ACEs in the Commonwealth is nearly $300 million, which is the sum of medical spending and disability adjusted life years or lost potential due to poor health, disability, or premature death. We know, Bloom Kentucky knows and understands that experiencing adversity in childhood is correlated with a number of outcomes, and the research shows that it's correlated with adverse social, health, and economic challenges. And the report details some of this relationship and also includes information on the prevalence of ACEs in Kentucky, noting that they are common. It also notes that ACEs are linked to a number of health conditions, and specifically in the report, we look at smoking, asthma, and depression. The report also highlights positive childhood experiences, which we know can buffer the impact of adversity. And actually, in a recent study by Dr. Segi and colleagues, found that these types of experiences, positive childhood experiences, actually reduce medical spending costs and provide additional healthy life years. While we don't mention that in the report, it was a later study that came out that highlights some pretty amazing findings about positive childhood experiences. And we know that legislators and leaders across the Commonwealth are thinking about economic implications, and we were thinking about how other reports, like the report produced in Tennessee, and how that was generating attention to upstream thinking. And Bloom Kentucky felt like this was a great opportunity to create a resource for advocates and policymakers alike in making the case for important policy and budgetary investments to mitigate adverse childhood experiences and to promote those positive childhood experiences.
So, Dr. Melton-Fant, you supported the development of that Tennessee report from the Sycamore Institute and the impact of ACEs in Tennessee. For our listeners who are wonks, like who really like to dig in to the data and understand it, can you give us some more information about the data and research that was pulled together to make a report like that for a state?
Yeah, so what there's unfortunately no single data source that kind of pulls all of these together. And so you're pulling data on ACEs, you're pulling data on the costs of chronic disease, whether it's the medical costs or the costs associated with, missing work or just not being able to show up in the world how you want to. You also have to have data on the other factors that shape health outcomes, because no method is perfect, but we really wanted to kind of isolate as much as we could that relationship between ACEs and the costs that we see.
So we see that one of the one of the key aspects of looking at adverse childhood experiences and the long-term outcomes on health, we know that that has costs to our state, whether it comes from covering services at the hospital or that loss of income due to not being part of the workforce. Hannah, can you talk a little bit about some of the policy and budget recommendations that we have identified through Bloom that connect to like solving some of those problems? Because we don't just want to talk about the cost, right? We want to talk about what it means and what we can do about it.
Absolutely. I always like to say Bloom Kentucky is very solutions oriented. So, not only are we talking about challenges, but we're also identifying some pretty significant opportunities for impact. In the report, we highlight 5 categories of strategies. And I'll discuss just a few of those, and then we'll kind of talk about some of the specific strategies that Bloom Kentucky has identified for this upcoming session. But those 5 categories include ensuring a strong start for children. Just to contextualize that further, that means expanding access to things like childcare and using tools like child and family impact assessments to assess policy efforts to make sure that when we're crafting policy or we're thinking about budget investments, that they are making sure that they're student and family centered and create strong starts for kids and families. The other categories include strengthening economic supports for families. So, this includes policies and budget investments that reduce the impact of poverty and promote family stability. Family first programs like SNAP, WIC, Medicaid, paid family maternity leave, access to safe housing. Definitely any of those policy or budgetary investments that are going to ease that financial strain on families. We know connecting youth to caring adults and positive activities are so important. Investments in programs like Head Start, pre K, and school based mental health services. So, meeting kids and families where they're at in spaces where they are at. Advancing social norms and teaching skills that protects against violence and adversity. So, teaching things like social emotional skills, how to regulate, parenting strategies, because life doesn't come with a handbook, and also expanding research and awareness of local resources. And then the last category is all around promoting timely interventions that lessen immediate and long term harms. We know it's so important to increase access to health care and reducing the impact of parental incarceration, as well as strengthening data capturing measures so that we can be best informed and identify opportunities for prevention. All of these recommendations, these larger categories, they really prevent those adverse environments that may surround kids and families. And our true hope is to cultivate a commonwealth where all kids can flourish here in Kentucky. And some of the specific strategies that Bloom Kentucky is looking at for the 2026 session that we're super excited about is promoting housing stability by making some common sense changes to the eviction process. We know that housing instability and eviction can have harmful impacts on child well-being and development, and families who face eviction, even if their case is dismissed, often experience long-term barriers be disconnected from utilities. We know that utility disconnection is linked to multiple adverse childhood outcomes, including increased risk of hospitalization, developmental delays, and heat related illness or death. And in times of extreme weather, these common sense standards should be in place to protect health and the safety of our Kentucky families. Some other opportunities where policymakers can step up, assess proposed legislation through family child impact statements. This is pretty new. This is a new concept, but we do it in other ways, like through fiscal impact statements, as well as local impact statements. But essentially, we would be requiring a data driven assessment of how legislation affects various detriments of family well being. And we believe that this policy solution will ensure that proposed legislation considers conditions that may exacerbate ACEs as well as promote PACEs. We also want to establish a sales and use tax exemption for diapers. We need to improve families and their ability to meet their children's basic needs. And then our last opportunity that is very exciting is all around supporting youth mental health by creating mechanisms to direct the hopefully pending social media settlement dollars towards those positive childhood experiences. We know that PACEs have been studied as an effective prevention strategy for ACEs and have been associated with supporting positive youth mental health. So we have a real opportunity as we go into this session, and we hope that our Kentucky legislators are going to step up to that call.
So, Dr. Ellis, you heard a little bit about what Kentucky will hopefully be pursuing on the policy front and maybe on the budget front. Can you talk a little bit about the pair of ACEs and then how policy can impact or mitigate some of the impacts of those?
Mhm. Yeah, sure. So, when I first started working around the ACEs science, and it was really important to me to make sure that we speak about this work and apply this work in a very practical manner. I think it's really important for individuals to understand that ACEs, adverse childhood experiences, are not something that just happens to those people over there. It is one of the leading experiences that are common amongst all Americans. So when we look at that pair of ACEs tree that's behind me here, you see things such as homelessness, divorce, parental use of substance abuse, child abuse, neglect, sexual abuse. There are many issues and those are just part of the classic ACEs, but we also understand that living in poverty is an ACE itself. When you think about all of the experiences, but when we unpack that, Domestic violence or living in poverty does not happen in isolation. If you're living in poverty, that means you're less likely to have access to food. Food insecurity is a real ACE. Having a lack of access to safe and stable housing, as Hannah spoke to. Those are issues that, it isn't enough to go in and educate a parent about better parenting or to give emotional support and healing after. If these are enduring and likely by place, predictable and reliable outcomes because of the differences in how we have invested in basic needs such as housing, such as education, such as preparing and actually offering safe environments for our children and families. And so that's where the pair of ACEs came in. It was adverse childhood experiences in the context of adverse community environments. It's to push us and zoom out and to think about the context in which these things are occurring. I love the fact that, Hannah, you're talking about pushing housing because while that can also be a policy that affects and stabilizes households for families, think about who else has an opportunity to benefit from those policies. From elderly individuals who may risk also being evicted. And these are the people that some young parents sometimes rely on for intermittent childcare, for some, connect social connection. So when we talk about PACEs, when we talk about a safe, nurturing environment for children, we're also talking about a safe and nurturing environment for parents. Parents need community in order to be able to provide those positive experiences for their children. So that's the power of thinking through this systems lens using a simple illustration as a tree to get people to think through what's the problem that we're trying to solve and also measurement. So I think this is also important. Dr. Fant spoke to the data that were used, and I really have been pushing people in most recent years to begin to think about not data through the lens of and success defining it as the reduction of adversity. When we talk about community resilience, what we're actually looking at is measuring the presence of those supports, those buffers, those resources that actually help families bounce back because we can't prevent every trauma. But most importantly, we want, as you say in your literature, we want people to bounce forward and thrive. And the only way we can do that is if we're making those strategic investments. We know what works. We also know what works from a community standpoint to produce those positive experiences, not just for our children, but also for the community that will support them. That's what true community resilience looks like.
I love everything that you said, Dr. Ellis. And I think to your point, it's important that these policies are framed as helping children and families, but these are things that just help everyone thrive. And so these are good for everyone. And that there's always limits with data, but I think these reports are very much just an entry point to catch people's attention, because people come to this work from different perspectives, but some people are very compelled by a big number. And so this is a way to come in and then get into really, improving what you said, communities and just making a places that thrive for everyone, children, families, all of that.
I want to make a point here that will pull Barry, our friend Barry, here into the conversation because I do think that it's really important that you all have done a study that looks at the economic output impact of ACEs, but we can go so much further. And just down the river or upriver, I should say. In Cincinnati, we've been working with partners there, and we moved from just talking about ACEs and just talking about the economic impact to really saying, what is it going to take to address the number one driver of ACEs throughout history, and that's poverty. And so really thinking about what are those strategies, what are those policy opportunities that we have, some of which we're already investing in, but that will really move communities from a place-based perspective, from that merely surviving to thriving. And there are four components of this that I think are really important, can also apply to Kentucky, but it's looking at, we start with place first. So, you're talking about the housing policies. Well, we don't want to just blanket. We want to be really strategic about that, right? So, where do we want to enact these policies? Where do we want to invest so that we are moving and providing communities with access to the educational and community resources that are needed? Because typically, where you have unstable housing, you also have lack of access to fresh foods, you have a lack of access to economic mobility, lack of access to public transportation. It's not just a silver bullet. There's opportunities to open this up, this conversation about economic investment, so that we're really putting families not just to financial stability, but ultimately to asset building. So let me give you a really quick example of how we've been doing this in our work through both the Opportunity Dashboard, which is really helping philanthropy, business, community organizations, legislators think about not just the social return, but also the economic return on investments. And that's when we can really begin to look at what's the positive return. We can look at health metrics, but I think what's more important and what will get us stability with regard to the policy investments is if we're speaking to the economic returns on these things. So even and when we're looking at some of these housing programs and housing policies, what we knew is if we stabilize households, we actually have an opportunity to begin to reduce poverty rates, because when families are stabilized, they're more likely to be engaged in the workforce. When families are more engaged in the workforce, children are getting their needs met, full stop. More likely to get their needs met. And that also means when you're looking at families being stabilized, what you're looking at by a place-based perspective is you're stabilizing a community. So it's not about better policing. If people are actually getting their needs met, we are stabilizing, reducing crime. When we reduce crime, we're reducing community trauma. When we reduce community trauma, our children are more likely to do better in school. So that's why I'm encouraging people, there's a bigger story to tell. Rather than just focusing on the child, there's this ripple effect. And so for funders that I've been talking to, they've been saying, how do we tell that bigger story of impact? Because, we have these grant programs and we're seeing the effectiveness of that grant program, but there's a bigger story. And for the state of Kentucky, I think even just the housing piece of this, the housing policy, it's really important to think about that ripple effect. When you're so competitive, particularly like Northern Kentucky, competing with Cincinnati, for business, for Fortune 500 companies, for manufacturing, et cetera, et cetera. Well, this is going to have an effect on your labor rates, your labor participation rates, because people are stabilized. When you have more people that are participating in labor, you have greater economic vitality for some of your smaller cities, particularly those that have been left behind in the last 2 decades. When you do that, you're talking about increasing livability, not just for our children, but for all Kentuckians. And so I think that that's where we are at the point in ACE's advocacy, where we understand how to use the data. We are at that point where we can make these economic arguments that are really cross-cutting, because at the end of the day, ACEs are cross-cutting. So I'm excited to be a part of this conversation. I'm excited to be a part of the change in Kentucky. But I do think that this is well within our reach. And Kentuckians know when the going gets tough, that's when we get tougher.
May I say a word about that? You got me. Uh, the good news is, and I'm speaking now for Metro Louisville and the Gheens Foundation and grant makers here. This one of the most exciting things that has happened in my 10 plus years at the Gheens Foundation is that we actually now have our mayor, and we have a collection of grant makers and private individual philanthropists engaged in a permanent supportive housing opportunity that has just been launched. And with the recognition and all the wraparound services that go with that. So for the first time, we're actually seeing some action uh, as a result of the data and just reality. Um, so I'm really it's modeled after Milwaukee. Milwaukee did a program where they drastically reduced the homeless population. And so anyway, I don't want to take more time, but just to let you know that at least in Metro Louisville, we're on the ball and we are moving forward in that regard.
Yeah, and let's circle back to that because I would love to talk to you off this talk, but we actually started our work and just before the pandemic with the Louisville with the health department there. And they chose housing as their number one issue. And we did all the research and it came back to the disproportionate eviction rates in communities that were creating these cycles of trauma, people cycling in and out of the justice system, cycling in and out of substance abuse because of because of the predatory nature of some of the eviction policies there. So it is now not just looking at, and I think, Barry, I would love to have this conversation with you. It's not just measurement of the program itself, but how do you zoom out and tell that larger story about this is what change looks like in Louisville and can serve as a case study for the rest of the state.
And I think
We
really
we just one more thing. We did a lot of I say we, but the Coalition of the Homeless did a lot of the work around this, and we had a public event about, gosh, it's probably been a month ago now at a theater downtown, and we had 700 people come. So, there was a high level of interest, and these were people from all shapes and all parts of the community who were, kind of interested in seeing what was being proposed. And we're now in the process right now of putting together the model that it would be specific to Louisville, to Metro Louisville.
I was just gonna jump in and say, and that's really so much of the work of Bloom is generating this hope, this possibility, this belief that, if we're willing to work together, if we're willing to have these conversations, center the data, center our kids and families, that we really can transform the ecosystems that surround us. And so thinking about Bloom's work even beyond this legislative session, we're really trying to work with leaders to think upstream. One way we've been doing that is working with the Attorney General's office and thinking about how to utilize the historic opioid settlement funds in a way that, mitigates adversity and promotes those positive experiences. When we look down the road and in 20 years, we want to look back and say, we used that money and we made an impact on the kids and families in Kentucky that were devastated by this epidemic. And we also, Bloom Kentucky wants to make sure that youth are part of that dialogue. Um, we've been fortunate to have the opportunity to pull together focus groups and talk with young people in every nook and cranny of the Commonwealth, and asking them how they'd like these funds to be spent. And those focus groups led to what launched and led to be the Better Without It initiative, which is super exciting to see the Attorney General prioritize youth in such a way. And I'd like to think that Bloom Kentucky had a hand in shepherding that work and making that possible. And of course, beyond just working with leaders across the state, we want to work with local communities in an effort to transform their ecosystems and working to educate them on data and how to build strong coalitions and how to bring youth to the table and give them the support that they need to foster that inner power and transform their own communities.
And I think that beautifully dovetails into the question I have for Dr. Ellis, which is, you know, uh, what advice or what recommendations would you give when it comes to addressing adversity and building resilience for the Commonwealth of Kentucky? Like, what would your closing remarks or call to action be for our fellow Kentuckians?
The most important thing is to use your ears more than your mouth, which sometimes I can have a challenge with. But I think if we are going to truly address ACEs, we really have to listen to what is that adversity as it's defined by community. I think that was, when Felitti and Anda pioneered the science of ACEs, we have to remember it was a very non representative group. That does not mean that the data and the results are not valid. They are absolutely valid. But what may work for and how you talk about ACEs in, California, it's going to be very different than how you talk about it in Shelbyville or how you describe it in Franklin or how you describe it in Newport. That's just the fact. Different contexts, different experiences, different class, different education levels. So, understanding how individuals are describing what is an ACE for them, what is an adverse experience, but also an adverse environment and then pursuing and pressing. Like how we found out about eviction is really like that was going to be the issue that the health department went for, is because they started with trying to address the substance abuse issues for returning citizens. Because it was a revolving door. They would come out of jail, they would relapse, they go back into jail. And as we started having conversations, it was yes, there's an issue with regard to access to treatment, but more importantly, it was about safe and stable housing. Safe and stable housing so that they could get a good night's rest, they could go to their appointment with their parole officer, they could actually catch a bus that could get them somewhere, that they could access employment, that they had the papers that they needed. Kentucky has actually been one of the first states that ensured that individuals leaving from a correction site are have a state-issued ID. Do you know how huge that is? That's your way of getting employment, that's your way of getting, housing, everything. You have to be able to ID yourself. So but that would not have come had you not listened to the experience that leads to the outcome. So even in coming up with housing solutions, I'm gonna ask all of you to listen to the experience. What is the real challenge? Is it eviction? Is it affordability? Is it even convenience? Because you might be able to afford a house, but if there's no public transportation nearby, what are you going to do? So it's so many it's understanding the systems that are contributing to the outcomes. And then as you begin to understand that and hear that experience, then you know who needs to be at the table. Because it's not going to be a one and done with housing. Public transportation likely needs to be there too. So does economic development. It's no good to have housing if you don't have a grocery store, if you don't have access to health care. Think about all the things that make our neighborhoods where we live vital to us and viable. Why wouldn't we want that for our other families? So that's what I would say is the call to action is widen this conversation so that we're really getting into that soil of where that tree is planted and we're changing that soil. We're planting nutrients so it's more likely that they will thrive rather than just merely survive.
I I think that the way that you framed that is so incredibly one, it's beautifully put, but also really helpful when we think about moving forward on systems change, right? We need to listen to people who are impacted by those systems. We also need to meet folks where they are, whether it's addressing addiction issues or it's helping people to understand what adversity looks like in our communities and how it impacts individuals both short and long term. And I think that our lawmakers, especially those who are part of the housing task force and a couple of different committees that are meeting this interim, I think there's an opportunity that they have and that they are taking to hear from folks, experts, but also constituents and people who have been impacted to really help shape how they're moving into the 2026 legislative session. So, Barry, I'm going to give you final word here. If you look ahead at the 2026 legislative session, what is your best hope for the potential impact of Bloom Kentucky?
Well, Shannon, I gave thought to that. I knew you were going to ask me that question. So my hope is this, that all of the tireless efforts of the Bloom Kentucky team across the Commonwealth in communities and with legislators, in seed sowing, raising awareness, cultivating relationships, and information sharing, that all of those efforts will culminate in an openness on the part of each legislator, one, to receive compassionately in his or her head and heart the compelling case this report supports, and secondly, to prioritize passionately the policy and funding actions necessary to facilitate the solutions we set before them that will give every child the opportunity to bloom throughout their lifetimes. And that's my hope.
Thank you so much, Barry. And thank you to Dr. Wendy Ellis and Dr. Melton-Fant and Hannah for today's conversations and overall thoughts on how we as a Commonwealth and beyond, because we've got folks from outside of Kentucky really thinking deeply about what it means to mitigate the impact of adversity, but really create opportunities for our kids across the Commonwealth and our communities across Kentucky to thrive and to bloom. So we encourage our listeners to visit bloomky.org for more information about Bloom Kentucky, the impact of the pair of ACEs in Kentucky, examples of positive childhood experiences, including some sprout outs and highlights of partners across the Commonwealth, and then the report that we discussed today around the economic impact of adverse childhood experiences. So thank you again for listening. And for those of you who've tuned in to today's episode of the Making Kids Count podcast.
Thank you for listening to the Making Kids Count podcast. For more information and to listen to more episodes, visit kyouth.org/podcast. To support this podcast and our mission as the independent voice for Kentucky kids, please consider making a gift at kyouth.org/donate.